So if you would, tell me who you are and a little bit about your business.
My name is Dr. T. Foster Bryant, and I'm a chiropractor here in Naples for the last 18 years. I'm also an exercise physiologist, graduated from Auburn University in '98 with that. Went to chiropractic school. When I was in chiropractic school, I also specialized in pediatrics, so I do have a fellowship in pediatrics. But my real focus in chiropractic has been in chiropractic biophysics, or CBP, which is a structural corrective approach to the spine. It's more of a rehabilitation approach where our goal is to actually correct the spinal structure and posture, teach a patient how to keep it in position so they can not just get short-term relief, but really have long-term results so they can live the life they want to live.
Why do you love what you do?
I love what I do because I started out as a chiropractic patient. I had a really significant injury as a kid, ended up having seizures with that, had a lot of breathing difficulties, and a chiropractor really changed my life at 18. After my first adjustment, I didn't have seizures anymore and I didn't have any more breathing problems. So the other flip side, my real passion is being raised by great-grandparents and grandparents. I was raised by older people, and I always lived around older people too. Wherever they went, I went with them. And unfortunately, what I saw with my grandparents is I saw them all progressively having significant spinal problems. One of my great-grandparents ended up being bedridden for the last 10 years of her life with severe arthritis. Her daughter, my grandmother, took care of her, and over the years of lifting her, it ended up buckling and majorly compressing her spine. And then my great-grandfather ended up in a wheelchair too. And so I love what I do because they can be helped. They can actually be lifted back up again. Their pain can be radically changed. And what it does, it allows them to live the life that they moved to Naples to live. This is an active community, and it never made sense to me to work your whole life, beat the heck out of your body, and spend the last part of your life in miserable pain, not doing the things you want to do. So that's what I love about what I do.
What are some of the other ramifications of that spinal collapse, not having that structure?
When the spine begins to collapse and compress, we have to think about the sensitive tissues that sit in between the spine. The disc, most people know they have some sort of disc compression and herniation. But as the spine begins to compress and collapse, the disc is really like ice cream in the middle of an ice cream sandwich. Once it gets pinched and compressed, it has to go. And once it starts to bulge, it can hit the nerve. Then you have pinched nerves and you have nerve pain. Then the joints that actually hold the spine up begin to buckle. They have pain sensors. So now the facet joints begin to get into pain. Then on top of that, when those nerves come out the spine, those nerves go down our legs. So a lot of patients will notice that they'll get the correlation between the pain and going down their legs and their spine, but a lot of those patients also have significant digestive problems, constipation, diarrhea, a lot of older men that get compression, they can't get an erection anymore, and we've forgotten that those nerves, our nerve system controls everything in our body. So if your spine is the system that surrounds, protects, and holds us up, when it begins to buckle, compress, and collapse, those nerves that run everything in our body will begin to function at a lower level, and they'll have organ dysfunction. So there's a lot of other things that can come out of when a spine collapses.
What's unique about what you do as a chiropractor?
I think the thing that's most unique about what I do as a chiropractor is I practice an approach called chiropractic biophysics. And since my background at Auburn University was in research, when I got into chiropractic, I wanted to do something that I knew was going to work for a patient. I don't like the idea of trying something. And since we have that data, we don't have to try on anyone. We know who we can and can't help. What CBP does is it's not lay down, get cracked, get adjusted. There's no way that can fix a structural deformity in the spine. And what CBP looks at is we start from the ground up from your pelvis. Is your pelvis level? For 80% of people, it's not. It's tilted on one side. When that tilts, that causes spine to bend and buckle and compress. There's your disc compression, nerve compression, facet compression, scoliosis, a hyperkyphosis when they buckle. And so what we do in CBP is we look at each patient, just like we all have our individual fingerprint, we also have our own individual spinal problem. Once we go through a really detailed, 30-minute start to finish, we are going through a detailed exam, we take x-rays, then we use a digitization of those x-rays, and we put those x-rays together so we can see what a normal spine would be and where they're at, and it tells us exactly what we can do for that patient. Sometimes that patient can get tremendous care just by being lifted and a little chiropractic adjustments with some traction, okay? Sometimes the spine is so buckled. I had a 91-year-old come in yesterday who is here. Chiropractic will not be correct for her. If I pushed on her little delicate spine, I would fracture her back. So what we would do for her is we actually have three-dimensional corrective bracing that we can put her into the brace, and it'll provide the structural framework for her that she can actually get her body up again and begin to move. This is gonna help her IBS. This is gonna help her severe pain. She's a 97 out of 100 in pain. I mean, it's hard to live a life like that. So we're not chasing pain. We're figuring out what causes your pain and how to fix it. If you don't figure out why and don't figure out how to fix, there's no long-term solution for a spine problem.
So let people know where you're located.
Well, we're located right 2 doors down from Costco. So most people know where Costco is in Naples, off Naples Boulevard. So Costco is 2 doors down to the left, then there's Floormeister's, then we're right in between, and Staples is next to us. So very accessible place. We have great parking out front, and we can get you right in.
Are you open for business? And give me some details.
We're definitely open for business. We didn't change our hours at all going through COVID, and we were an essential, we're an essential worker. And one of the things we needed with having hospitals possibly overloaded was we didn't need to have back pain and spinal issue people going to the hospitals at that time. So it was really important for us to be open, but even more so for my current patients. My patients that begin care with us, they are on a planned program in order to get correction into their spine. So like I said, we didn't change our hours at all, and we probably were actually even a little bit busier during COVID, definitely more so than we thought we were going to be. So it was business as usual, and we had some of our best corrections right in the middle of this COVID. We have taken safety precautions. The first thing we did is, because we are a rehab-based facility, so we do spinal traction. Spinal traction is very complex, which means you have to have x-rays to determine for each patient what is the mode actually fixing their spine. But we brought our tables down, we spaced them out so we didn't have people close to one another. The wipes we've been using, we have a gym downstairs too. We use wipes, they've been COVID certified, so we've been using them since the day we've been open. So we wipe down all tables, all chairs, anything that we touch, washing our hands, which is really the most important. And for the people that wear masks, we also will put masks on for those people at the same time. My ideal client is, we're kind of in between chiropractic and surgeons. We're looking for the very difficult cases. I want the patient that walks in that says, I've had 17 epidurals, I've had back surgery, and I'm still in tremendous pain. I had an injury to my neck, a whiplash, and I still have numbness and tingling. What we're looking for is people that have significant functional and pain deficits that are chronic, that they're really sick and tired of being sick and tired. Those are the people we excel with. And it's been really one of the best compliments that we regularly get referrals from other chiropractors. They'll send us their really difficult cases. We get referrals from pain management doctors when they don't know what to do with a case, or the injections aren't working, or they can't even inject them anymore. And then of course the worst cases are people who have had back surgery or multiple back surgeries, and a lot of times they're even worse than before the surgery. And probably I would say the worst of the worst are the older patients that are on walkers and canes and leaning on a shopping cart just to get around. Life does not have to be that way. There are really excellent things that we can do for you so you can get your body back up again, you can get active, and you can enjoy that we live in paradise. We're definitely a family-owned business. A week after I graduated from chiropractic school, I began working here in Naples, so there was really no break for us. And my wife, Erin, also has worked with me from the very beginning. She came in and learned how to run the office, and then now she's transitioned and running the gym. She's an exercise physiologist also, and she's just been great to provide the support and the stuff that I'm weak on, she's great in. We have 2 kids here, 16 years old and 13, he'll be 14 soon. And We just love the Naples community. I mean, I'm from Alabama, but I'm a Naples, Florida boy, and I'm going to be the rest of my life here. And we just love supporting families, and I'm talking families from the youngest to the oldest. At the end of the day, what we want to do is I don't want to just be an average chiropractor in Naples. That would hurt me to think at the end of my career that I was just a chiropractor. So what I've really pushed myself to do is I've strained myself to learn. I'm continually getting recertified. I'm certified in CBP. That's very difficult to become. I am the scoliosis brace guy in Southwest Florida, and I may end up being even more involved with scoliosis brace in the future. Some exciting things coming with that too. Yeah, the best way to get in touch with us is our phone number, 239-513-9004. But we also give free consultations. If anyone wants to just come in and talk with us and see what we do, we offer our time so up front they know if we can help them. If it's a case we don't have success with, we don't take them. We don't waste time for people, because when people are suffering, we're not there to slow it down. We're there to speed it up. We also have a Facebook site, Movmnt. You can go on Movmnt, check out Facebook. We're there, and I would encourage you to listen to our testimonials. I mean, we have some amazing testimonials of patients sent from some of the best surgeons and best neurologists and best pain management doctors in this town that have been told that's the best they can do for them. And then you hear the stories after they've done something like CBP and wearing a scoliosis brace or a kypho brace, and their life is restored. That's who we're looking for. If you really want to change your life for the better, we will help you with that. So if you have children, if you have other people, your spouse, and they have problems, bring your family to us. We will take care of them like they're our family.